Take a look at this man. Look at his face. He has his arm outstretched. What do you suppose he's saying? And why is this 3-year-old behind barbed wire? Doesn't that create within you a sense of injustice or tragedy? Surely this man is saying, help us, advocate for us, care for us, get us out of here, me and my daughter. And so at this moment, we have conflicts around the globe. Now, Gaza certainly is a horrendous situation, but there are parallel problems at the moment in Sudan, in Yemen, in parts of Assyria, in Myanmar. And as a result, people like us look at this and say, there must be something we can do on behalf of those individuals. But we have people right here in the United States. And so let's bring it back to Denver or Minneapolis or Chicago or wherever you're from. And let me just pose a question to you, and I'm going to ask you to respond. Raise your hand so we can get the microphone to you. When you think of people who are struggling day to day in your own community, who comes to mind? Homeless people. Who else comes to mind? Immigrants, yes. Struggling middle class. Single mothers. Elderly. People who are disabled. Those who are chronically ill. Those with low income. And so everything we're talking about in this next session is on behalf of people like this who are right here in our midst as well. Now, the account of the Good Samaritan is one that most of us have heard multiple times, but remember, the younger generation, there are many, many people who have not heard the account of the Good Samaritan. And so it bears remembering that every generation needs to be reminded of the principle of a man who was traveling from one city to another and was brutally attacked, beaten, robbed, and left for dead. And what happened next? People walked by and left him. So it was the priest, the religious leader. He had appointments. He had to be there. People were depending on him. And so he passed by. And then who was next? Well, it was a Levite. It was a governor, a civil servant. Well, he had appointments too. And so he kept walking. And then finally, it was the least probable person. It was the outcast. It was the foreigner. It was the illegal migrant who stopped, got on his knees, probably got covered with mud and blood in the process, cared for the man, paid for his rehabilitation. This is a timeless principle for today, a principle that we who are leaders in the health professions need to remind those in our circles. My story began with this book, Deliver Us from Evil by Tom Dooley. Anybody else here read Deliver Us from Evil? Well, I was going to be an aeronautical engineer. I took all the math classes in high school and wasn't real good at math. But that was my plan. And one day I was browsing the library at my high school and I came across this book. And the title, of course, immediately grabbed my attention. It is the account of young Dr. Tom Dooley, 28 years old, in the U.S. Navy, put in charge of refugee care at the outset of the Vietnam War. Now, in the late 1950s, refugee care was not a discipline. And so young Dr. Dooley was making this up as he goes. How do I find food for 500 new people arriving every day? It's cold. What about housing? They can't find their children. How can I help these desperate parents locate their kids among the throngs of people? And yes, they were ill. They had yaws. They had dysentery. And as I read his account of providing compassionate care on behalf of these Vietnamese refugees, I said, forget about airplanes. Somebody else can do that. This is what I want to do with my life. And so as a medical student, I began looking for opportunities to emulate the life of Dr. Dooley. And I went to my dean and I said, Dean Jonas, I want to work with an American doctor somewhere in the developing world. Can you help me? And he said, that's a great idea. Good luck. Let me know how it goes. And I said, Dean Jonas, I don't know who to talk to. I don't know how to set it up. I don't know how to pay for it. I don't know what to tell my parents. And he said, you'll figure it out. And I did, and I had an inspiring experience. And so as a resident physician, I chose Burkina Faso, West Africa. Burkina was and still is the very poorest nation in the entire world. And SIM had a network of small clinics in Burkina Faso. Well, I did my family medicine residency, and then I did public health at St. Louis University, and I moved to Shanghai, China in the 80s. Now, this was before the economic boom. Most doctors in Shanghai were living on $20 a month. Reflective of the city in general, we had schistosomiasis, we had rheumatic fever, we had tuberculosis. And over that period of time, I cared for some people, but I met the elderly Chinese who had begun working in that church-sponsored hospital caring for the poor back in the 1930s. Well, following my time in Angola, I moved to Angola, a nation in southern Africa. You all know where Angola is located, don't you? Oh, you don't? Well, I'm sure you'd like to know. When you look at a map of Africa, Africa looks like this. And so here we've got the desert, and then we got Kenya over here as the left hand, and Angola is the right knee of the continent of Africa. Angola was best known for their civil war. They had been fighting for 40 years, and as a result, the 120 church-sponsored hospitals at the beginning of the war had dwindled to only one. The war escalated in Angola, and after a couple of years, I had to evacuate along with so many of our expat staff. And I came back to the University of Missouri, where I began teaching, and approached by those medical students who said, I want to do that too. Can't you help me? And I thought back to my experience with talking to the dean a few years earlier, and I thought, yes, we can help you. We can create a pathway so that you know where to go and who to talk to and how to set it up and how to pay for it. Now, you are here because someone inspired you. You know, your great-grandparents, they probably would remember Albert Schweitzer, the German theologian who lived in Gabon, and people of my generation, Dooley, and then more recently there are those like Paul Farmer. But the next inspiring individual, it might be you. You might be the one whom young healthcare profession students and residents look to as one who is offering expertise and compassionate care on behalf of the world's most forgotten. But there are questions associated with this kind of a career. We know the world is in need, but we've got questions. Now, I want to begin by talking a little bit about how we go about making decisions. First of all, you and I are crazy privileged. We have a degree of wealth, we have education, we have people who love us, we have certifications, and because of this, everybody wants our attention. They want our donation, they want us to join their team, they want us to vote for their candidate, And we can't possibly do it all, and so we have to make decisions. So decision making is a basic life skill. Some people are pretty good at it, and others not so much. I like to begin with the importance of prayer. And I find that even people who do not consider themselves to be spiritual often tell me that they pray when they are confronted with a major life decision. There is a sense of clarity that often results from prayer. And then for every option, there are great things and there are not so great things. If you meet, ladies, single ladies, if you meet the perfect guy, I mean, he's perfect. He's wealthy, he's handsome, he comes from a good family, he's really smart, he adores you. He's perfect. You might not know him well enough. Now, I hope you meet a perfect guy. I'm all into that. But there are pros and cons to everything. And so I was trying to decide what nation I was going to serve in, and I made a grid. Some of you have probably made a grid before. I see several people smiling. Yeah, you know what I mean. And so I put the nations in the columns, and I put my criteria in the rows, and I scored them. 1 is bad, 3 is good, and I added up the columns. A little compulsive? Yes, indeed. But it did help me to understand what I was really considering in working through my decision-making process. And then recommendations. So you talk to somebody who has done this before, someone who is 5 years ahead of you in their career or 10 years ahead of you. And I always tell young people to ask your parents. Now, they may not know anything about career, anything about medicine, but they know you, your strengths, your weaknesses. And so, at the very least, honor your parents by asking them what to do, what you should do. So I went to my dad and I said, hey, I'm going to take your grandkids. You're going to move to this country 8,000 miles away, be gone for 3 or 4 years. Yeah, they got a war going on, and they're not paying me. What do you think, Dad? And of course he said, no, that's crazy. Why would you do that? And your parents may say no too. And you may say no to your children. But at the very least, we have honored our parents by asking their input. And then important decisions are usually not urgent. Urgent decisions are usually not that important. So I compel people to give it time. Give it time for clarity as you press forward. Now, if you want to focus your career on serving those who are poor, those who are non-English speakers, those who are unemployed, who are migrants, who are elderly, who are disabled, who are chronically ill, there are certain obstacles. And I want to present this question to you and ask you, what kind of obstacles would you face providing care for those sort of people? Raise your hand. Financial obstacles. What else? How are you going to pay for it? How are they going to pay for it? How are you? Yes. Yes. Medical problems within your own family. How can you provide care for others if you yourself have got limitations at home? Yes. What else? What other obstacles? Time available. Yes. I mean, you're busy. You've got kids. You've got practice. You've got. Where are you going to find the time? One of the most striking cultural differences, and that is actually, I think, one of the biggest obstacles of all, is language and culture, dealing with people who view life and who view health from a much different lens than ourselves. And so that's why we are talking about launching your international healthcare career, or rather your healthcare career on behalf of all these forgotten people, wherever they may be located, even in your own city. Now, so let's talk about some professional decisions for a moment. Now, you have already decided your specialty field, but those who are beginning in medicine, they really don't know. And so they'll say, gosh, what should I go into? Should I go into primary care, surgery, OB, HIV? How this question is answered has really evolved over the years. 40 years ago, you must be a surgeon. We need procedurists. And 30 years ago, you must be infectious disease. We have HIV to deal with. And now more recently, it is primary care. But in answer to this question, what field should I go into? I usually advise people, do the field you love. Do a field that you could do for 50 years, whether it's in Indiana or in India. There will probably be plenty of people who will benefit from your skill, especially from your skills. What about education? If you're really focused on these forgotten people, do you need another degree? Do you need some advanced training? I have a public health degree. Probably a few of you might have a public health degree as well. I did my degree after I came home from Angola, and it was fascinating, analyzing health policy and health financing and these things about cultural issues. But honestly, it really didn't change anything that I have done in Africa since then. The most inspiring thing about the public health degree was all the people I met. It's sort of like this room full of people, and you meet together every week for a year and a half. The most important principles of public health you knew in high school. Wear your seatbelt, get your vaccinations, eat right, wear your bike helmet. Applying those things into your career as you're caring for people will take you a long way. What about tropical medicine? Did you know that you can get a master's degree in tropical medicine? You could go to Tulane or Brussels or London or Liverpool or Hopkins, spend a year studying tropical diseases. Well, it's expensive, and there are no tropical diseases in those places. But you would sure learn to know some important principles and some wonderful people. Now, today I lead the Institute for International Medicine, which is a graduate school with the mission of equipping healthcare professionals of all types. We deal with people in dentistry and pharmacy and PT and OT and medicine and nursing with the unique skills to care with expertise for people who are living on the margins of society. Our biggest event of the year is the Humanitarian Health Conference. It's an event rather like this we do in Kansas City the end of May, and it's a chance for people to, first of all, meet one another. It's about half students, which is very intentional. We want to give them a vision of this is something worthy you can do with your career. And it's also a chance to connect with sending organizations like those who are outside next to the coffee. Groups that you can talk with about volunteer opportunities, short opportunities, career-long kind of opportunities. That face connection is critical. And if you have not gone around and met all the exhibitors before we leave at 12:30, please do that. You might find a connection with a group that you would want to actually serve with moving forward. And then it's a chance for people to present their scientific posters and their intellectual work in the field. Now, during the year, I'm very busy. The most popular course we teach is the Graduate Certificate in International Health, which touches on those unusual diseases, cross-cultural skills, disaster management. As physicians, we are increasingly being called on to be leaders in disaster management. We didn't get that in medical school. But nevertheless, having some understanding of those principles is very, very helpful. And then I think the most important is health leadership. You and I know how to provide care for people one at a time and do that very, very well. But what do you do when you have hundreds of patients that you cannot possibly see one at a time? that you need to delegate duties, that you need to set up systems to provide care for large communities. Again, that's not something we learn in medical school, but as you progress in your career, as several of you have already discovered, you're being called upon to provide care for large numbers of people. And then credentials are very important. It shows that you not only have a good heart, but that you've backed it up with some diligent study. And as you know from your work in developing nations, credentials are even more important, in their kind of context. Now, we teach some hands-on skills because medical students today are often not learning how to suture, how to splint, how to use a bag and mask, how to use an ultrasound. And so we're trying to fill in those gaps in education. But what we're best known for is service learning. You know it as international rotations. So I work with faculty in 25 countries who provide mentored, precepted rotations. And the reason we have so many places is because we want to offer a spectrum of opportunities. Now, about half of our participants are students and residents. The other half are mid-career physicians who say, it's finally time for me to do what I always wanted to do. And now I've launched my kids. And now I've got some more discretionary time and resources. And now I really want to do this. And so if you're kind of at that point in your life, I'd love to talk with you. I know others here who are leaders in service would like to talk to you about how you could potentially serve. Now, this is my mentor in Angola, Steve Foster, Canadian general surgeon. He's been there for 45 years. And his work is especially in orthopedics. And so we send everybody who wants to do trauma and ortho to do their rotations with him. Anil Cherian does maternal newborn health in India. Excellent preceptor. And then our most popular credential is the DIMPH, the Diploma in International Medicine and Public Health. I have a little blue card at the check-in desk with some details about that. Our highest credential is the master's degree in international health, which builds upon those course elements with some research and some epidemiology. And let me tell you about John Cocarillo. He came to me a couple of years ago, a Zambian physician who said, I would love to move to Angola and provide cataract care. Now, in all of southern Angola, we have one cataract surgeon. Only one. And about 8 million people. And you know the prevalence of that disease among them. And so for his master's project, we paired him up with John Clements. Some of you know John Clements, who is at University of Oregon right now. John spent 7 years in Angola training Angolans how to do these sight-restoring procedures. Now, let's say that you have prepared yourself and you are moving to a community that has people who are struggling day by day. What are you actually going to do? Are you going to see patients? Probably. Are you going to do research? Are you going to do health leadership? Are you going to be like Dennis Burkitt? Who knows Burkitt? Yeah, a few of you know Burkitt. So Burkitt was a British GP in the 1960s who moved to Uganda. Now, he had no special training, just went out there to care for people. And he noticed these children who had tumors in their necks. And he said, that's really weird. We don't have that in the UK. And so he just did basic epidemiology. Where do they live? What do they eat? Who else in the family has got these? Did some pathology on it and identified what we know today as Burkitt's lymphoma. And we have a cure for it, actually. It's caused by Epstein-Barr virus. But it began with a non-specialist, inquisitive physician. And so to me, the lesson is, in whatever endeavor you're doing in healthcare, keep that inquisitiveness. That's probably where the next breakthroughs will come from. Now, you're not going to do this kind of work alone. You're going to do this in association with some other people. And so do you choose the ballpark or the ball team? What do I mean by that? Well, the ball team is the organization that you work with. You know, let's say that you have an allegiance to Samaritan's Purse. You know, that's your team. And I will go wherever SP sends me. I want to work with SP. Now, some of you, by contrast, might say, well, no, my allegiance is to the ballpark. I want to work in downtown Detroit. I want to work in Dakar. I want to work in a particular community, and then I'll find whoever is there to associate with. But my dedication is to that particular community. Well, both are fine, and I've done both myself. But let's break this down. If you were going to choose a ball team, a Samaritan's Purse or other, what would you look for? So I want you to raise your hand and tell me, what criteria, what qualities would you want in a sending organization?
Financially stable.
Financially stable, yes. Got to be a group that's not going to fold tomorrow. Christian worldview, yes. Well organized. Previous results.
Help you when things go wrong.
They will help you when things go wrong, as they inevitably will. Now, there is no perfect organization, just like there is no perfect man. But some are far better than others. And so having some experience with an organization and choosing one that lines up especially with your values is a prescription for an enduring relationship with those people. Now, the values piece, I think, is especially important. Yes, you want them to have financial resources, to have emergency evacuation, to be well organized. Ideally, someone that you might have actually worked with before. But if your values line up, your motivation line up, is praying with patients really important to you? Then you probably want to work with an organization that would welcome you to pray with their patients. Now let's turn it around. Let's say that your allegiance is really to a community. And I want to get a show of hands. I know many of you have done international service. Do you feel a particular allegiance to a community? You think about them. You stay in touch with them. You might want to go back and serve them. Lots of people nodding, raising their hands. Yeah, exactly. Now, what is behind that? Why do you feel that way? Tell me. I care. So you probably have an emotional connection with those people. Why else? Yes. Cultural identification. Yeah, you are from that culture, or you understand that culture. Maybe you have some language skill that helps you to bridge that cultural gap. What else identifies you with a particular community? Early life experience. Yeah. Is this someplace that you went with your family? Do you have relatives there? Maybe your roommate was from that place. Those are all very important. Now, it's a really big world, but to be effective, of course, we're going to have to focus in on a particular people. And so begin with the relationships you already have. Now, if you say, yes, God is moving in my heart and I want to dedicate so much of my time to caring for uninsured people, to providing free care, whatever your particular calling is, But it's a huge world, and there's all these organizations, and I go online and I see all of these. How do I possibly choose? Well, start with the ones you know. Those that you've met at this conference. Colleagues that you have already been working with. Those maybe you have traveled with if you are interested in continuing international work. This question of where and with whom is much less daunting if you put it in context of who do I already know, what relationship can I build upon? What if their language is not your language? Adult language learning, that's a pretty difficult undertaking. Who struggled with high school language? You took French or German, or you had a hard time. Yeah, me too. Like, I failed high school French more than once. And I came out of that thinking, I will never learn another language. There is no way. But let me reassure you, language learning is mostly about motivation. I had no reason to learn high school French. I did not know a single French-speaking person. There was no outlet for that skill. But if you get into a community context where the dominant language is something else, and you need to be able to speak that in order to go buy groceries or put gas in your car, suddenly you've got a strong reason to learn, and learn you will. Now, it's going to take you a little longer than a 2-year-old, however, and so you might have to dedicate some serious time, months or even a couple of years, to learning a language. But of course, professionally, you will be much more effective and more satisfied, and a secret language learning can be kind of fun as you see the little progress that you make. But you are probably going to have to put aside some time to focus on that skill. Now, when are you going to do this? So we're building on the question of, I want to serve people who are on the margins. Now, is this going to be my full-time gig? I'm going to move to Dakar. I'm going to move to inner city Detroit. Is this going to be something that I do on my vacation time? I've got my 2 weeks. I will go to Honduras. Is this something that I will do later in life? I've launched my kids. My 401k is fine. I have some margin now. Let me just take a show of hands and ask, when you look at options for commitment, do you see one that might fit you? See one that might fit you? Most of you are saying, yes, that's right. There is none of these that are the best. You might have a disabled child. You might have elderly parents. Maybe you can't move to Dakar, but you can certainly provide some amount of care for the marginalized right now in your own context with the resources available. That honors God and it honors humanity. And if you have got enough margin that you want to move far away, then that's wonderful too. That clicks the boxes. It honors God, it honors humankind. And so it's up to each of us to decide what is the best fit for our particular life situation. Now, up to this point, I've been talking about professional decisions. I'm going to shift gears in a moment, and we're going to talk more about the personal side of life. Now, I'm going to finish in a few minutes, and I want you to be thinking of some advice you might have for the crowd. You've been through this decision-making and the will of God thing, and you have some pearls that you want to share with the group. This will be your opportunity. We're going to open the mic and let you share that pearl. Maybe you have some question. Maybe you have something in addition that you want to share. Be thinking of that, because we're going to open it up pretty soon. What is this going to do to your family? Let's say that you decide to take your family and you're going to move to another culture, whether it is in this country or in another country. But their customs, maybe their language is quite different. What's that impact going to be? Who's done this before? Let me just see a few hands. Yeah, there's about 15 of you who have done this before. Can I just get one of you to say what was the impact? Yeah. Okay, here comes the mic. Yes.
We didn't anticipate moving mid-career, but moved mid-career for 2 years to Ecuador, bringing 4 kids, and I didn't think we should go because my kids were too old. And I've seen this with other families as well, so just be aware if you're making decisions, the impact on your kids can be positive and it can be negative. We had 2 kids that were changed amazingly positively and one that was changed negatively. So there was blessings and challenges in that regards.
Yeah, thank you. A lot of research has been done on this question of cross-cultural families and what is the impact. And I'm going to generalize and say that it is not bad. Generally, couples report having more time together. Children report having more time with their parents. It's not a panacea for a happy family, but it doesn't seem to hurt when you look at large numbers of people. Anybody else have a cross-cultural family pearl to share? Let's do one more.
I just say, well, a couple of things. One, if God is calling, I would look to a call. So if you feel called to do something, then that is your focus. If God is calling you and you're married, he's also going to call your spouse. If you're married and you have children, it's not that he called you to Africa or to some other far-flung place and said, oh my goodness, I forgot you had children. He knows. He knows your past, your present, your future. And if he's calling you as a family to go someplace, he knows all those things. So you need to trust in that if you feel a call. And I would really look to that and rest in that, even when it's hard. And there may be challenges that come along. There will definitely be challenges. We spent 5 years abroad in Indonesia. Huge blessing to our family. Also some challenges, but God can work through those for good as well. So I would really kind of focus on the call. And if you feel called to do something, trust him, that he's got your family as well.
Yeah, thank you. Excellent. What about debt? This is the number one reason why younger healthcare professionals tell me they can't do what they want to do. They owe. And they feel such a burden for that. What kind of advice would you give a 28-year-old physician who is burdened by debt? Let's hear a pearl.
Well, I would suggest starting with short-term, 1-week missions.
Start short-term with 1-week missions.
Right.
Okay.
I mean, you don't have to, if you have a lot of debt, you don't have to commit to, several years and that worry. Plus, you need to kind of I would think it's a good idea to get your feet wet.
Yes, excellent. Get your feet wet. Appreciate it. One other financial management pearl for the young indebted physician.
I would just tell them there's an organization here called MedSend, and I would tell them to go see the folks out at MedSend because they'll help them with their debt if they really feel called to go.
Excellent. Thank you.
And I would also add, you can join the military. I'm active duty, debt-free. They'll pay for med school. If you're a resident, there's a FAP program. They'll give you another $60,000 during residency. You'll make $100,000. You have plenty to pay back your med loans. You can do missions also in the military. So in 2008, the Navy sent me with the U.S. Army to go into Burkina Faso to do cataract surgery.
Wow.
And I remember that day vividly. We showed up, 2,000 people showed up. There was a guy that walked 300 kilometers with his friend because, as you know, they're all blind in cataracts. Did M6 there, and we did about 200 plus cases. But there's also those opportunities in the Navy to do that around the world.
Yeah, thank you. Looks like we got one more compelling comment.
There's also the Samaritan's Purse post-residency program, so they pay for housing, lodging, travel to get you established overseas for your first 2 years out of training. So definitely consider that.
The main principle that I use when in talking with young healthcare people in debt is keep living like a resident. Did you go hungry when you were in your residency? Probably not. Probably not even when you were a student. The problem is, of course, is that we tend to take on more debt as we progress in our careers rather than pay down our debt. And so keep living like a student, keep living like a resident, use that excess income to pay down your debt, and be out of debt by the time you're 40. A lot of us are still not out of debt. Now, if you're going to care for forgotten people, you yourself are going to have to be healthy. If you are struggling with a disability, then of course you're not going to be as effective as you would want to be. And so managing your own health is a priority. What is the leading cause of death among Americans who travel abroad? I hear traffic accidents. What else could it be? Heart attack? Malaria? Pre-existing disease? You are right on top of it. It is actually traffic accidents. So you stay out of those brightly colored minivans, and whatever you do, do not rent a moped. Something like 85% of all deaths of Americans happen because of this. And then the other 15% happen, as you said, because of a pre-existing healthcare problem. So you can get cerebrovascular disease just anywhere in the world like you would as if you were here. And so managing your own personal health issues is critical. Less than 1% of deaths are due to an infectious disease. So it's probably not going to be meningitis that takes you down. Stay out of those. Most of you are motivated by your faith. Now, if you decide to move to another place, there's going to probably be a strong emphasis on your medical skills. You've got all these patients to see, all these people to care for, and you are going to be drained, just like many of you are probably feeling drained right now. And that's one of the virtues of coming to this conference, is because you're connecting with people who are also following Christ. And so relish this for the next 2 hours. And meet somebody new. Exchange contact information. This, in terms of your relationships and your faith community, this could be a very important day. And you're going to use that principle wherever you go in the world. You're going to find those who are following Christ, who are worshiping the true God, everywhere. But you may have to intentionally reach out and get out of clinic and reduce your patient list so that you have got a little margin in order to do that. Now, the last point I want to make is about licensure and documentation. Many of us go to Guatemala for a week. We used to go to Haiti for a week. Someday we will. And we care for patients free of charge. Is that legal? Within the legal medical structure of those countries, is it legal for an American to step in with no documentation, with no licensure, and provide patient care? It's a valid question, and the answer actually varies a whole lot nation by nation. In Angola, where I work, you must be licensed somewhere in the world. That's good enough for them. As long as you can show that you have a license in Germany or the UK or the United States, fine. Ghana is much different. Ghana requires you to have a Ghanaian medical license, even if you're only providing care for one day, even if it is completely charity care, volunteer, no money exchanged, you must have a Ghanaian license. And so we do that in order to be respectful of that country. Now, we're probably not going to get arrested, but we want to be above board in our interaction with them. You can also get international medical liability insurance that covers you from malpractice anywhere outside of the United States. Now, I have been insuring resident physicians on international rotations for 23 years. I've never had a claim. But if it ever happens, if there is a disgruntled patient who decides to sue one of my rotators, we got a policy that covers them. And you can get a policy that covers you as well. There's several companies that offer it. Gallagher is the one that I use at INMED. But for $3 a day, you can get a medical malpractice policy that'll cover you outside of the United States. So you want to make sure that you cover that. Well, in summary, launching your international medical career, your career on behalf of the world's most forgotten, we have looked at some of the questions, some of the principles of decision making, but often it comes down to passion. What is that calling that God has put on your heart? What is it that you think about in your free time, on weekends? Where does your heart go? If that is the place it's going, that's probably the most important factor of all, is that sense of calling, of passion that you have to provide care for people who may be far beyond the normal medical system. Now, what kind of advice do you have or question would you like to share?
Just a simple concept that I've gathered over the years, partially when taking perspectives and missions course, and that is that we don't go on mission for God. He takes us on mission. And so following Him, developing a relationship with Him is the key first step.
Yeah. Thank you. And to that, I would add that, of course, these kind of service experiences often stretch everything within us. Physically, they stretch us. Financially, they stretch us. The family relationships, they stretch. And so the resilience that we have from our walk with Christ is often absolutely essential and may grow as a result. How about another personal experience? Here's one.
Raise your hand. Oh, there you go.
When my patients say to me, "Oh, you're such a great guy for going on your mission trips," I say, Jesus is right. Whatever you give up for His sake comes back to you 100-fold. And just to bring that home, even though God may take you, if you take yourself, you're still going to experience, if you focus and give credit to Jesus and point people to Him, it's just going to come back 100 times.
Well said. Thank you. I'll look forward to talking with some of you during the break. My card is at the front desk, and bless you.
Thank you.